It's a disease that affects over 6 million Americans. In the month of November, health professionals dedicate time to spread awareness on Alzheimer's. With a focus on the mental health of those affected by this disease, psychiatrist Dr. Mirnova Ceïde joins us for discussion. Thank you so much for joining us, Doctor.
Thanks for having me.
So, I just want to start off by talking about the disease. Can you tell us what is Alzheimer's and is it hereditary?
So Alzheimer's is a type of what's called dementia. And when I'm explaining dementia to my patients, typically dementia just means very serious changes in your memory and function that don't seem to go away. They last for many years. Alzheimer's is the most common form of that. And it's caused by some changes in the brain cells that cause the cells to deteriorate that lead to changes in your overall function. So the second question was it hereditary? That's a complicated question. The majority of Alzheimer's is not hereditary. That being said, most people will say that they have someone in their family that had Alzheimer's, but it's because the biggest risk factor for Alzheimer's is age. So if you have older people in your family, then you may have one family member who has Alzheimer's. There are some genetic components to Alzheimer's, but that's different from being hereditary, meaning they kind of spontaneously appear in your genes and can cause Alzheimer's, but it's not that it's necessarily being caused by, the parents having it and then you're definitely having it. It's very rare to have a genetic, a hereditary form of Alzheimer's, which would kind of lead to a younger onset. That would be in less than 10% of the cases.
Okay, interesting. Thank you. Now, I understand that there are several warning signs. Can you tell us what they are?
So the warning signs can be a little concerning, especially in older adults, because you worry when you just forget something if that's what's going on. But generally what you're looking for is a pattern of changes that are happening again over time. So maybe misplacing something, but not being able to retrace your steps to find it. Getting disoriented with the date and time. So that, of course, especially in COVID, sometimes we forget the day of the week or even the date. But if you're getting confused about the year or the month or what holidays pass by, that might be a change. Having difficulty working more complicated things like your microwave or your smartphone when you were able to do it before, or starting to get lost driving in areas that you're familiar with, leaving the stove on. All of these are the signs that someone might be going through Alzheimer's. So the big picture is that really changes in your memory and ability to organize, but not just a one-off, it's a pattern of changes.
And when should we start looking for these signs? Because I know it's like older people, but that could change from person to person. So what is like the ideal age you should start looking for those signs?
Well, generally we do screen people who are 65 and older at their annual wellness visit to see if they have any memory problems. So normally you go to your doctor once a year, once you hit 65, and they'll ask you if you've noticed any significant changes in your memory. So that's standard. But if you do have other risk factors, advanced kidney disease, strokes, things like that, that may be bigger risk factors, you may ask let your doctor know to check in with your memory earlier on. So in general, over 60 is when we're looking, but obviously if you see changes, let your doctor know.
Now, we don't want to alarm anyone, right? So how do we differentiate these signs from just typical age-related changes?
Right. And so this is really, really the most important thing, is that it's not something that should be constantly on your mind to be worrying about. People can forget things from time to time, particularly when things are stressful or when you're isolated and you're not doing anything. When you go from working, sometimes you really are not on top of the day of the week or the date. So that's really typical. Generally, once or twice, if you have something happen, forgetting a word or forgetting something, it's not something to worry about. What you would be looking at would be a pattern of changes over time, very consistently, months to months to months. So don't really worry if you have an event happen once or twice.
Now, what are some of the mental health challenges people experience after getting an Alzheimer's or dementia diagnosis?
So I guess there's two ways that I look at some of the mental health struggles that our patients go through. So one is just dealing with the diagnosis and coping with having a new chronic medical illness. And that can be difficult for not only the patient, but also their family member, because it can change things. It can change what you thought your future was going to be. So that's always difficult. In addition, because of the nature of the illness, because our brain also controls our emotions, about 50 to 75% of people who do have a diagnosis with Alzheimer's will suffer from some kind of emotional depression, anxiety, apathy, some kind of change in their mood.
Now, how should family members and caregivers approach someone who they believe may be experiencing Alzheimer's?
I would say the best way is cautiously, and in terms of like not really making somebody very anxious about it. If you do notice a change, the most common thing to do is just say, let's talk about it with your primary care doctor. And the reason that's important is because there are different medical illnesses that can look like Alzheimer's. So, for instance, undiagnosed hypothyroidism or vitamin deficiencies can all present with changes in your memory. So it's very important if you do notice changes or if you notice those changes in your family member, make sure you get to your primary care doctor and have a full evaluation.
So, I believe that when someone in your family is affected by this, it can really change the dynamics. Can you just explain how this diagnosis could impact several members in a family?
Right. So, families really are their own ecosystem. And so everybody has a role in a family and that develops over time. And so sometimes when somebody gets a diagnosis of Alzheimer's, it's not just the fact that they have memory issues, it's the impact of that on the day to day. So maybe that person's no longer able to drive or no longer managing the finances. So then now somebody else has to take that over. So it can be very sad and stressful for the person who's not able to do it, but it also can be overwhelming for the person who now has to take over a new role. And so it's important to think about the whole family ecosystem, not just one person.
And how does this stress differ from caring for people who have other, disabilities or different needs?
It is a unique challenge, as a partner for somebody who's dealing with Alzheimer's, because sometimes, because of the emotional changes and the ability to participate in things, it just changes the dynamic of your relationship. If you have a physical illness, you still can, listen to music together and enjoy it, or be able to recall something that happened and enjoy it. Whereas in Alzheimer's, it really may impact the quality of the relationship in that way. And so it takes some additional counseling to be able to overcome that.
Now, I've read that a healthy diet and exercise and things that can stimulate your mind can help prevent this. Is this true? And is there anything that can be done to prevent Alzheimer's?
It is true to a point. It's not magically going to reverse Alzheimer's if you have it, but the overwhelming data does show lifestyle changes make a difference. Not only does the data show, we actually are seeing there's less new cases of Alzheimer's by proportion because of more health, of being healthier, getting on top of your vascular illnesses, treating your high blood pressure, getting on top of your diabetes, getting active, doing more stimulating activities. There's actually all have been shown to work. Not necessarily different supplements that you might read about, but the overall activity, in particular, challenging cognitive activities and physical activity. So one of the best ones, for instance, is dance, because that makes you have to remember choreography and do physical activity. Those kind of activities are really helpful for stimulating the mind.
Now, what are you kind of mentioned dance, so I feel like this kind of goes into that. But
Mhm.
what are some ways, we can make life more meaningful, with members of our family or friends who are experiencing memory loss?
Well, this is a really good question because you start to lose your ability to complete some of your activities of daily living. Sometimes people really go through a bit of an identity crisis. So you want to focus on what people can do, not on what they can't do. Someone can still be a part of the family. So if that's someone who really loves to cook, maybe you're not cooking on your own, but you can kind of do something with the family together and cook a favorite meal and mention the recipes that you want, or go through old albums together, look at different memories. That can be very stimulating and positive for people. So really making sure that the person who's going through dementia is still a part of the family, even if they can't do 100% of it. If they can do 30% of it, let them do that 30% and then support the 70%.
Now, how can mental health professionals support families and caregivers of those suffering or not suffering, dealing with dementia?
So one of the biggest things that we can do as mental health providers is, one, just acknowledging that this is really difficult and overwhelming for everybody involved, and making sure that we're providing additional support for the mental well-being of folks with dementia as well as their physical well-being. And in addition, making sure that we have that time with the caregiver so they're able to grieve these changes and be able to have some support for them as well.
And so, what are you doing now just to reach out to these patients? What services do you have available to those who are in this situation?
So one of the most important things is, in addition to if you notice a change in your memory, seeing your primary care doctor, is getting to a dementia specialist. So at Montefiore, we have our Center for the Aging Brain. It is a center of excellence for dementia care in the Hudson Valley region. And so that would be something to get a full evaluation, so that you're seeing a geriatric medicine specialist, you're seeing a neurologist, a geriatric psychiatrist, a social worker, neuropsychologist, and getting a full testing to really understand what's going on, because sometimes people can have memory changes from a medical reason, or it could also be from another kind of dementia other than Alzheimer's. So it's very important to get accurate diagnosis.
Now, I understand that this is not something that is going to affect everyone, because as you mentioned, that doesn't mean it's always hereditary, but it is, a part of life. What would you say to somebody who may be struggling to accept the fact that someone in their family may be dealing with this, or for the person themselves that think that they might be dealing with this?
Well, definitely, one of the most helpful things that we have in the community are support groups. And I know early on, sometimes it's really hard to accept the diagnosis, but being in a support group, even just listening to what other people have experienced, will allow you to connect and understand that you're not the only one going through it. And they can give you ideas of how to have the most meaningful life possible. The biggest thing, again, is just really engaging on what you can do, and really having positive experience that way, while accepting and clarifying what your diagnosis is.
Now, doctor, thank you so much for joining us. Can you tell people where they can stay up to date with you, and Montefiore in general?
So definitely you can find out about our services at montefiore.org at the Aging Brain. You can find out how to connect with the Center for the Aging Brain. Also, you do want to look at your local community providers for any kind of Alzheimer's support, caregiver support groups like Caring Kind NYC or alz.org for just overall resources.
Doctor, thank you so much for joining us.
Thank you for having me.
That's all for our show today. Thanks for tuning in. I'm Kibin Alleyne, wishing you and yours safety and wellness now and always. See you next time.